Greetings, everyone, and welcome to the Digital Dental Podcast. My name is Neil DeMazier, and this is the podcast where we cover all things digital dentistry with industry professionals, insiders, and kind of give everybody the inside scoop on what's going on with digital dentistry in today's modern age. With me today, I've got Jimmy Ruiz, who is the Dental Business Manager for Roland DGSHAPE. Jimmy, thanks for joining us here today.
Thanks for inviting me.
Yeah, and we're doing this here today at Lab Day Chicago, which is, of course, the industry's biggest event for all things laboratory and digital dentistry. So it's a great time to just kind of sit down with some folks like yourself and talk shop, you know?
Thanks for having me, man.
Yeah,
Appreciate
absolutely. It's my pleasure. So to kind of start things off, I mean, Roland, obviously it kind of goes without saying, is kind of like the granddaddy of milling, right? In dentistry, right? Right up there with kind of like, 3M Lava, right? With some of the really first, companies that brought milling and, CAD CAM dentistry to the industry.
Yeah.
Right. So kind of being in that company, maybe kind of talk us through kind of the progression a little bit. I mean, it all started off with the DWX50, right? Back in the day.
Yeah, well, in dental it started then, but when we look at Roland as an entire history of the company, it started way back with music instruments. Because it really was a progression and just continue to use that technology into other things and to other industries that evolved into dentistry. So our beginning starts with, music synthesizers, the 808s and drums that Roland had in the 70s and 80s.
That's funny because I've had people ask me that, be like, is it the same Roland that makes like the electronic drum kits and the keyboards and stuff? And it is, right?
It's originally from there.
Yeah.
But what happened is then, probably about in the early 80s, about 81, they started a digital group.
Okay.
And that focused more on like plotters and, other types of technologies that evolved into large format printing.
Yeah.
So that from that large format printing, we also had, engravers, cutters, and a jewelry mill.
Okay.
Right.
Yeah.
And from that, and continued to evolve into the DWX50 that you mentioned, which was the first dental mill that Roland introduced.
Right.
Yeah.
So it's kind of like a natural progression because things like plotters and cutters, stuff like that, folks might not be familiar with that, but it's kind of like a knife that gets moved around in kind of like X and Y to cut out, graphics or whatever it might be. And a printer is kind of the same idea. You've just got a print head that spits out ink, but moves in X and Y, right?
If you ever go to the mall and you see these glass figurines that have like, like a glass block with engravings inside of a face on that. So that type of similar technology.
Yeah, okay. Okay, so, and the company kind of grew that and matured that and advanced it from something, comparatively simple. You're just holding, a cutting knife or an ink head.
Exactly.
Onto something more sophisticated, like a 4 or 5
axis. And exactly. So with the DWX50, they often say how you can fine tune it like an instrument because the way that it was the calibration that you can actually do that.
Yeah.
But we evolved. We came out with the 51, then the 42, introduced a wet mill as well. Mm-hmm. All open source technology that was affordable to laboratories, right? Mm-hmm. You no longer had to spend thousands upon thousands of dollars to get into it. You had something that was cost effective for you, allow you to start making money quickly. So it's a great progression. So it wasn't actually until 2017 that an official dental group was formed, which was DGSHAPE.
Okay.
Because before that, it was, printer salespeople that were really in the industry, introducing that technology.
Right.
And having something great, let's see if it hits. And it's the number one brand in the US.
It hit. It sure hit, right?
Sure did.
Were you part of the company back then?
I was not actually. This Lab Day is my 3rd year with the company.
Okay.
I started probably like a few days before Lab Day.
What a time to start.
I know. I was just jumped into the fire, but it was not my first Lab Day. I mean, I've been in the industry coming close to 20 years next year.
No way.
Yeah, I started at Kerr at the age of 26 doing customer service. This is before, this is around the time that Cybron has sold to Danaher, that eventually became Cavo, that eventually became Envista.
Yep.
But I was there for 7 years and I learned a lot of, consumable products, dealing with clinicians, and the laboratory was a small part. But it wasn't until I went to Glidewell and I spent 4 years there. I was the sales manager for the sales division, and I just that's such a great school to learn
Yeah.
dentistry from.
Yeah. Glidewell is kind of an incredible company in that they do a lot of stuff in-house.
Yeah.
Right.
Yeah.
You know, a lot of their own development of, you know, whether it's consumable products or even equipment or even like packaging, stuff like that.
Yeah.
It's kind of it's an inspiring take on how to build that type of business, right?
It is, and it's a formidable story, you know, the Jim Glidewell story, and just looking at just solutions for his own lab.
Right.
That's how the sales division really started, looking for divisions for solutions for his own lab.
Yep.
That people said, "Can I buy that?"
Right.
You know, and look what it is today.
That's when you know you're onto something good.
Exactly, exactly.
Right.
Yeah, but you know, so I was there for about 4 years, and then I did another 4 years in a small family-owned reseller.
Okay.
In Fullerton, Oregon. You know, I helped them get into CAD/CAM.
Yeah.
And then I to Roland in 2022, and you know, keep going ahead.
There we go.
It's been great.
Nice. So tell us a little bit about like the company culture of Roland. Like, you know, I know every company has its own kind of, you know, fabric that it's made of.
Exactly.
You know, what's it like at Roland? How's it been different from other businesses you might have worked at in the past?
You know, it's really somewhere in the middle, right? It's somewhere in the middle between a large corporation like Danaher and that small reseller that I was at. The great thing about it is that even though we're such a big company in the Americas, we're not a big company. When you look at Roland as a whole, we're probably less than 150 people. When it comes to the dental, we're up just about 7 people, not counting the support that we have.
Right.
So it's a small team. So, you know, we wear a lot of different hats, and it's always about the customer. And that's some of the things that I really like about this team. It's one of the high performing teams that I work with, that is people from the industry that understand the industry. So it removes a lot of like explaining, right? We're such a niche industry compared to others, right? That we have our own way. And, you know, understanding the customer, it's what's made us different, not just on the dental side, but also on the inkjet side.
Yeah, no, that totally makes sense. And you're right. I mean, you know, you mentioned the jewelry industry a few minutes ago, right? Of how Roland brought a milling solution for jewelry. And, you know, having had a little bit of exposure to the jewelry industry and of course a lot to the dental, you know, laboratory manufacturing side of things, there's a lot of similarities between those two, you know, a lot of, generation after generation handcraft, you know, kind of knowledge base, right? But both of them were kind of some of the last industries to kind of be brought into the digital manufacturing space, right? And even, you know, even now, you know, I have a, you know, jeweler in the center of my little town, 2nd generation, and, you know, he designs all of his rings in CAD. He prints them off in wax and he casts them. You know, so you know, they've come along just as the dental industry has.
Yeah.
You know, so it's a really tremendous kind of progression to watch happen.
It's exciting to be part of it. It's exciting to see it, you know, because even when we look at digital X-rays, when it came in, and, you know, you have to like wait for the film to be developed and all that, and now it's instantaneously. Yeah. So when we look at CAD/CAM, it's the same thing. That's my passion for it, to see how we can use technology, because I've always been kind of like technology buff, just in my own personal life. So, you know, using the technology to help you, I mean, that's amazing. That's what we made it for.
Yeah, work smarter, not harder.
Exactly.
Right.
Yeah.
Yeah, 100%. So you've been at Roland for what'd you say, 3 years now?
3 years, yeah.
Yeah. And how has it kind of grown just in that time? I mean, if I think back 3 years, you guys were probably just coming out with the 52 right about then?
No, actually, the 52 came out in 2018.
Oh, okay.
And we released the 53DC around that time. We also had the Plus series out as well. So it's progressed quite a lot. You know, we've focused a lot on being able to provide more than just a machine now. It's providing you a solution, right? This is like hot topics in our industry that we cannot just sell parts. We need to be able to help them with the entire flow. So for us, it's been, you know, able to work with our partners, you know, that, you know, other components that go with our machine, to make sure that the customer had, ease of use and simplification of it.
You guys have really embraced that. I've noticed in the past 12 to 18 months with, really having a close relationship and integration with, the CAM software, right, that you guys use, which currently is Hyperdent. That's one component of it, but also on the material side, right, bringing those materials in and, like you said, providing that complete solution to the people that make the decision to purchase your equipment.
Exactly.
Right.
Exactly.
But what, and like, that couldn't have all been easy, right? Like, what have some of the challenges been there?
Well, it's finding the right partner, right? Finding the right partner and finding the right solution that is going to be helpful. For the CAM side, I mean, it to us is we're always going to be an open system, open source system.
Yeah.
But
and that means like any CAM software can be used.
Exactly.
And any HAD software can be used.
Exactly. Any materials that are open, 98.5 millimeter disc can fit into a machine, no problem.
Yeah.
But it's being able to give you a what we call the validated workflow. You want that easy button.
Right.
We've done the work for you. Yep. Right. If you're a tinker and you want to Frankenstein your own thing, like you have it right here as well.
Go for it. Yeah.
But that's what we want to do. We want to be able to simplify it for the customer and just remove some of that guesswork, because when we started, right, as an open source system against the closed systems that were, predominantly out in the market, we wanted that flexibility. But we've grown so much that, as a mature market, we understand our needs. Well, let's plug those in. Like, it doesn't mean that, you don't get to do what you want. It's just that you have a package here that over time we've developed, we understand, and it's going to be able to give you the output that you want. Right. The predictable outcome, I would say.
And that's so huge, right? Predictability, right? Because, at the end of the day, the people that purchase these machines, they're in business, right? And at the end of the day, you only have so many hours in the day. And it's like, if you purchase a piece of milling equipment or a printer or whatever it might be, you could invest those hours into doing your own R&D, right? To figure out how to get, whatever CAM software you like or whatever cutting tools, milling burrs you prefer, or materials to all play nice together, right? And get that repeatable, dependable, predictable outcome.
Exactly.
You could invest your time there. You could, but is that really going to get cases out the door quicker?
And just being ready, right? Like purchasing anything and being able to use it as soon as you unbox it. That's important. And then we know that in our industry, when you make a decision to purchase equipment, it's not because you're planning it out. It's you need it right now.
Right.
So what can we do to help you out? Let's try to cut that time.
Yeah. 100%. So you've done the CAM side of things, integration.
We've done the CAM integration, and on the material side of the wet mill, on the blocks, we've added glass ceramic material, that is comparable to some of the, brands that you're used to seeing, some lithium distillate material, some sinter zirconia material. That, that the technology has advanced. We've been able to validate those in our mills, and we've gotten great results out of it.
And how do you guys go about, you've mentioned validation, validated workflow, we validated these things. Unpack that process for me. Like, how do you guys validate these things?
So the business units outside of Japan are mainly to, sales and promote the product in different regions. Like there's an office in Europe that covers the entire Europe. There's an office which is open in India. We have one in Brazil, and then here the one in California actually covers all the Western Hemisphere except Brazil. So we work with the global team, see the needs in our market, see the materials that are coming into a market, communicate that with the global team, acquire those materials, work with the tooling manufacturers, with the CAM manufacturers to dial in those strategies, test the material, see how it performs with our machine, and the output that we're getting out of it. So once that testing is done, it's validated by Japan.
Okay.
And then we do the testing here too. I want to make sure that, we do our due diligence. Thank you for doing that test. Now let's see how it performs in our market.
Right.
Right. And so that process, we have a product manager, Juan Molina, who's been with the company for a long time. He does a lot of that validation and work with the global team.
Gotcha. So it all starts at Roland headquarters in Japan, right? That's where the initial kind of R&D and validation happens.
And we feed them. So the different business units are saying, hey, we're seeing this material coming into our market.
Okay,
Yeah. This company reached out to us. We're interested in looking into that material,
right,
and seeing if we can have it validated in our workflow.
Gotcha. Right. So you're kind of providing them that kind of market specific information about these are the materials that this market wants, right? Or these are the indications that this market wants, right? And they kind of take all that, do their development, and the product they deliver to you is that validated workflow, which then you like revalidate and be like, okay, you said it was good. It is good.
It's good for North America.
Now we can put it out to our customers.
Exactly.
Yeah. That's great kind of,
Collaboration. It's a lot of collaboration.
Yeah. And how long does that take? Is that weeks? Is it months?
It depends. It could be months. Yeah, it depends on it depends on the product. It depends, where the material comes from as well. So it's just a lot of factors in play, but it does take like a few months.
Yeah.
So
Can be hard, right? Because like, the trends in dentistry move quickly.
They do.
Right. So I'm sure it can be a challenge to try to be really responsive to those, and, customers, God love them. They always want
Now.
to be able to do what the doctor wants,
Exactly.
Right away.
Yeah.
But it would almost be like irresponsible to put something out there when it's not fully validated.
Exactly.
Right?
Exactly.
You know?
Yeah. So for us, it's a process, but it's a process that needs to happen, especially, when it comes to some of these indications for, chairside solutions. We want to make sure that, the doctor feels confident with that as well, that material. So, that's a checklist for us, when working with a company, it's like, do you have, FDA clearance here? What kind of workflows you have? Do you have an office here? So we can support that material as well. I mean, it's great that we're a global industry, but it's important to have someone that you can pick up the phone and talk to.
So important. Right. I remind people of that all the time. People get a little bit too comfortable just sending emails. It's like, if you really want to get something done, just pick up the phone.
Right? It's incredible how fast things get done when you pick up the phone.
Yeah. Yeah.
Being able to spot that is important, right? When it's important to pick up the phone. It's the same thing with the materials. It's like, it could be a material that maybe hasn't gained traction, but we see a lot of potential from it. We got to jump on it right now, do our due diligence. And if it works out, great. And if it doesn't, we learned. Right? Because that's important. And that's what we've done on the material side. We've also, expanded our portfolio into 3D printing. There was a lot of, let's face it, fear from the milling industry of what 3D printing was going to do.
Yeah.
I think we've learned a lot from it. I think that there's a lot of potential and a lot more growth that's going to happen with it. But, let's talk about how they can work together instead of, against each other.
Right.
Because even coming from an alloy company, before, there's still a lot of alloy and a lot of metal being used today. So even though zirconia is king, there's still an application for it. So down the line, years from now, it's going to evolve. Absolutely. Materials are going to continue to get better. So let's bring that in and talk about how we're providing a solution and not just a machine. We're not a milling machine company. We're a dental solutions provider, right?
Right. Which, is a great kind of perspective to take, right? Because if you kind of put the blinders on and regard yourself purely as a milling only company, that really limits you in terms of the solutions you can provide.
Yeah.
Right. So yeah, the ability or the whatever you want to call it to bring on, develop and release a 3D printer, that is complementary to the milling product line.
Exactly.
Is a great position to take.
Yeah.
And
then the other hot topic is, the Internet of Things, right? We're a lot of, cloud-based solutions, we're also involved in that. We have the DGSHAPE cloud where you can connect your devices and, be able to monitor a lot of great things on it. So it's not just one thing. It's like, how does it all come together, the ecosystem?
Yeah. I'm glad you brought that up, because I think that's something that Roland offers that I'm not aware of any other milling machine company that offers is, by way of your V-panel control software, right? And, the cloud functionality that you mentioned, the Internet of Things, right? We have customers at Imagine that, have dozens of Roland mills throughout, in equal number of labs, and there can be one person sitting at one computer overseeing the operation of all of those, right?
Absolutely.
So, like, what are I know it's possible. I haven't played around with it a lot myself. So can you like break down like, if I have, a dozen 53s out there all strewn about the country and I'm sitting at my computer looking at the screen, what information does that give me?
Well, you're able to see a lot of things. You're able to see the status of the machine.
Okay.
So
Status meaning like operational,
operational. On the newer series where we have a camera, you can actually see a milling in real time.
Nice.
Right? So you could also see from there, you can see the job history. You can see what type of objects you've milled.
Okay.
What type of material.
Oh, wow.
Right? So you can see the frequency. You can see your output of the machine. And then on the maintenance side, you're able to see your collet life, your spindle life, so being able to see in those components makes you more flexible and being able to make decisions faster, right? So if you're looking at, the maintenance of your machines and like the maintenance is due, that's also gonna pop up there. And you can set up all your mills, so you can set them up in different locations. So if you have, a lab or several labs in one region, you can set them up there. The different types, wet or dry, you can see it all.
Nice.
So that's the important thing about it. The operation of it though, you still have to be there. So vPanel still needs to be used.
Of course.
Yeah. It's more of a monitoring system that allows you to see the performance of the machine.
Yeah. And it's, it's not a value add only for large organizations with large numbers of machines, right? Like I could see this being, something that brings tremendous quality of life to, a small single location lab that maybe has, a 53 DC, right? And, that small business owner might leave that to operate unattended while they go home to the family and have their dinner, and they might be able to check up on it, after you put the kids to bed and check out, make sure everything's still going as planned, and not have to drive back to look at it and make sure everything's cool.
There you go. Yeah.
So I think that's really, really forward thinking. And it's one of the things that really impresses me about the Roland milling product line that isn't really strictly milling related.
Exactly. And we're going to add more to it. I mean, there's definitely more plans to adding to that platform and seeing other things like inventory management. You be able to log in there and have access to inventory management.
In terms of like, what pucks do I have on the shelf?
Exactly.
Oh, wow. Okay.
What pucks and, what are they used, to what percentage of they use, how many crowns have it done. So stuff like that.
So it's really cool.
Stuff like that. It's exciting because, it's all connected. So if we can have that ecosystem, and then we talk about what's down the line, there's a lot of hot topics, a lot of buzzwords, this year, like robotics or AI, right?
Yep.
So what does that look like for us? We continue to explore, seeing how we can.
What does it look like for you? You want to give us some teasers there?
Well, for us, it doesn't. I mean, there's just R&D. Yeah, there's nothing that we could say that it's gonna come out like right away, but exploration into those things, we look into it and see how we can leverage it and incorporate it into the DWX family.
Yeah, 100%.
Yeah.
Speaking of things that are kind of coming down the line pretty soon, I know the 42W is about to be replaced by the 43W. Is that what I hear?
No.
No?
No.
You sure?
Well, the 42W is on back order right now. But if you are aware of the Roland history and the mills that is released, you can kind of anticipate, we came out with a disc changer, we came out with a single puck, what will be next, right?
Yeah.
So I think that's what has led to it, and just the demand of showing a shortage of 42s because of the demand, and then it's like, what's next? So most likely. I mean, we wouldn't come out with another disc changer again, right? But we're looking at a lot of different technologies and seeing what is feasible and what is ready for us to be able to provide. Because I mean, as I mentioned earlier, a lot of testing has to be done. So
of course,
there's a lot of easy buttons that we're looking to be able to be available for our industry.
Nice. So yeah, definitely maybe we can look forward to that.
Maybe, the progression.
Yeah.
You know,
Yeah.
it's due, I guess. I mean, the 42W also came out in 2018.
Right.
You know,
Right.
so
So
it's
just
been
like
a
we've seen it, you know, go from the 52, you know, to the plus to the 53, you know, so we might see a similar progression.
Yeah, because we did the same thing with the 42 and the 42W to the 42W plus.
Right. Right. And remind me, like, what was the major differences from, you know, that 4252 that was a mainstay for years to the plus version? But like, what did you guys change?
It was the spindle. It had stronger gripping power and just a stronger spindle overall to just keep up with the demand of our, you know, of our mature industry. That's what it really came down to. Something stronger. And then when the 53, you know, while we were working on the 53, and then came out with the 53, and it's just the overall more robust machine.
Yeah.
You know, allows you to do PMMA, you know, a lot more confidently, and all other materials as well. So we're really excited for it. This is the 53 series is really being focused as that all on X type of mill for us.
Right.
And a lot of people are making a lot of money off of that.
That's right. That's right. So, I mean, you know, for labs that really put them to work and get the most out of them, you can get a lot of production out of that machine in a single day.
Yeah.
You know,
I have a buddy that actually had bought a 52, a D plus, and he told me he was doing about 20 full arches a month. And I started doing the math, and I'm like, man, you already paid off for your mill.
Right.
And he chuckles. He says, yeah, that's why I got a second one. Yeah. And I didn't even know, you know, and I was like, wow, it's amazing.
Yeah. Yeah.
Amazing.
Which is a smart move. And it's one that, you know, you'd be surprised how many labs, even large multi-location ones, kind of underestimate how much they depend on a piece of equipment. You know, in my experience, anytime you have a piece of equipment that's running at about 65, 75% of its capacity, it's time to add a second one, right? Because if you're depending on that machine that much, you know, God forbid it goes down, right? You're in trouble, right? And you know, let's call it for what it is. You know, we live in an imperfect world. Everything breaks down at some point, you know. So it's like you can get the best machine in the world, but it's going to break down at some point. And when that point comes, do you have a
have to have those contingencies? Yeah. And I think, you know, we make it really easy for you to grow with us, right? Or so we can grow with you, I'm sorry. Being able to get that second machine, you know, being able to maybe get 2 machines, depending on what your needs are. Like, you know what, I'm going to start doing more production. Maybe I need a wet mill now. So we try to make it a lot easier. And we're partners like Imagine. It's like easier because it's like you guys know the customer, you guys know their needs, and you know, we confidently feel that when you guys take care of them, you know, they're gonna be in good hands.
They'll be in good hands. Yeah, we certainly do our best, you know. You mentioned earlier the chairside segment of the business.
Yeah.
Tell us a little bit about, like, you know, I mean, we were talking about the 42W a moment ago. You know, that's been positioned as a chairside kind of solution. How does Roland approach those two sides of the industry differently, or how different is it, right? Chairside versus lab, you know?
Absolutely, it is definitely different. I mean, when we look at the knowledge base, you know, on both sides of the of dental, the dental laboratory is far more advanced, right? You guys have been dealing with it for years. You guys have grown with the technology, whereas on the clinical, it's been of a slower transition, right? When we look at clinicians who've been, you know, doing business for 10, 15, 20 years, been doing VPS impressions, or, you know, trying to switch to the intraoral scanner, it's a big jump. You know, so being able to identify that customer and those customer needs, because for us, if you're going to be using a milling machine, you need to already have been scanning, right? I'm always wary of when I hear stories of a clinician that jumped like full in, because we understand the learning curve of each, the scanning, the CAD, you know, the milling. So if somebody has been doing it for years, they've been working with the laboratory, and it's important to work with your laboratory. It's not that I'm cutting my laboratory off, it's that we're transitioning some of those solutions in-house, but we're still going to use the laboratory for the more complex cases. So, you know, the dentist using the laboratory to leverage that learning curve is important, you know. So for us, the approach is, you know, look at somebody that's ready for that and having the right partner to support that customer.
Yeah, to see them through that progression.
you know, even laboratories, right? We talk about a small lab, maybe they get a second mill. There's that option is not there with the clinician, right? Once that mill is down, the whole production is down. So the expectation on the clinical side, it's a lot higher.
Yeah, it really is.
No.
It really is.
And you know, the monsters of the industry when it comes to CAD/CAM, you know, the Soronas and the Avaclars, you know, they've done it so it's all into one ecosystem. So it's the customers really emerge into it. Whereas an open system, it's a little bit different. So working with a partner that understands that, and we can even leverage the materials that the dealer has, it's important to present it to the customer saying, okay, here's the package for you to start. You've been doing the scanning, we're gonna help you on the milling, we're gonna help you on the printing, and start with small stuff, right? You know, single unit posteriors, you know, do them all day.
Yeah.
You know, you want some interiors, maybe send it to your lab. If you want some bridges, absolutely send it to your lab.
Yeah.
But start small. So being able to identify those customers has been great. We've identified that in certain types of practices, not practices, specialties, you know, the knowledge base is a little bit higher. Like if it's implantologist, they have more understanding of CAD/CAM and the whole digital treatment plan.
Yeah. Prosthodontists tend to, you know, be more predisposed to kind of wrapping their heads around the CAD/CAM process, right? Because they're kind of lab techs at heart a little bit, right? You know, so that's what we've seen in our business quite a bit. But yeah, you mentioned earlier, and I couldn't agree more. You know, we've seen, you know, you see them regularly, right? You know, docs that might come to you and say, you know, I don't do any digital now, but I'm going to get a full system, right? And it's I think they're taken aback when my answer to that is like, you know, maybe you should dial it back. You know, it's crawl, then walk, then run, you know, and like you said, you know, get to the point where you can do your own scanning and it's boring, right? And then bring on design, do your own scan and design and get to the point where that's easy, you know, and then maybe bring on a printer and just kind of start doing night guards. Yes, like, you know, easy stuff like that, you know,
Exactly.
and get to the point where like you can do that with one hand behind your back and then graduate, you know, to milling.
So we can educate them, we can, you know, onboard them into the technology, but to what's important to me is to listen to them and see what their need is, right? And I talked about that easy button. That's what they really need. So I understand I may not have it today, but let me take that information back.
Yeah.
So tomorrow we can have something that you feel confident that if you're going to buy all that, that is going to be an easy process, an easy solution, ease of use, and all those.
Yeah. Something that you and your staff can use.
Absolutely.
You know, without, you know, whatever, needing an engineering degree.
Yeah.
You know, and deliver cases to the patient, right? And at the end of the day, that's you know what it all comes down to. And you know, from the patient perspective, I think a lot of people are just becoming, you know, that expectation on the patient side is more and more the expectation is the same day crown, right? So it's like when you look at the relationship between the clinic and the lab, you know, like you said a moment ago, it's like just because the clinic is getting, you know, scanner, CAD/CAM, and chairside mill, doesn't mean the lab has no place anymore. It simply means that, you know, the clinic's customers have an expectation that has changed, right? They don't want to come back in a week or 2 weeks or a month or whatever to get their crown or whatever.
But we're also seeing a lot of dentists doing their own in-house labs, right? So it's not just them doing the chairside, but bringing on a technician and having all the work being done, which seems to be full circle, right?
Right. Yeah.
Which is interesting.
Yeah. Yeah. One-stop shop.
Yeah.
You know, which is pretty good, you know? So, so yeah, looking forward, you know, into the future for Roland. I mean, obviously, you know, no promises, but like, you know, where might the product line progress from here? You know, you made the step from, you know, the 52 to the 52 plus, brought on a more robust spindle. We've got the 53 that kind of encompasses those things and adds more. You've got the Internet of Things. You know, is the 54 or the 55 going to have an even more robust spindle? Like, where might it go from here?
Well, I think that when we look at the technology and the needs, there's a lot of interest still here on metal milling. So even probably looking at, you know, more robust options to be able to do that. That's a possibility. I think that when we look at what actually I can say is I don't know when this is going to come out, but depending on when it comes out, there'll be a surprise at IDS.
Oh, yeah?
At the Roland booth.
Nice.
Something totally out of what you've seen before, and it's interesting to see. You know, if you had a chance to go, please take a look at it.
Yeah.
I can't say much about it because that's when it's going to be unveiled. But
There we go.
well,
Well,
something
wouldn't want to get you in trouble, but
totally out of left field.
that's pretty cool. Well, I'm not going to IDS, but if any of you are, stop by the Roland booth. Tell me where to see, please.
Please do. You can't take pictures though.
No. That's awesome. Cool. Well, we appreciate that. And, you know, believe it or not, you know, we're getting ready to wrap up here. So I think I'll end this interview the way I like to end every single one and just ask you, Jimmy, do you like going to the dentist?
I love going to the dentist.
Yeah?
Yeah, I'm actually in the process of getting my crown after I had spent 6 months with an implant.
Yeah.
I had to, believe it or not, I had a root canal done over 10 years ago that I had to be redone, and they couldn't save the tooth. I had to get an implant.
Yep.
And I'm ready for my crown, and I love going there, getting my cleaning. It's weird. Like, people get freaked out. My son, my daughter, they don't like going, but like, let's go. Like,
Go.
I love it.
Do you get like, I know for me, it's like, I kind of want to be all up in their business about like,
All the time.
you're scanning me, right? You're gonna,
Yeah.
what software are you using? What are you gonna, you know?
Yeah. Like, you know, my office already knows me, but when I first started going, it was funny because I would like ask questions. They'll be like,
You're like, what are you talking about?
those words that you're using, or how would you know that?
Right? Yeah.
So it's fun. I like it. And, you know, you get a good relationship with your dentist.
Awesome. Awesome. Well, that sounds great. I hope the crown comes out great and fits nicely and is comfortable for you.
Absolutely.
And Jimmy, thanks a bunch for joining us on the podcast.
for
Man, it was
having
great
me, man.
having you.
Appreciate you.
Yeah.
Yeah.
It's my pleasure. And of course, thank all of you for joining us. I hope you enjoyed this interview. And if you're here at Lab Day Chicago 2025, I hope to see you out on the show floor there. But yeah, thanks as always for listening and watching. And, you know, happy CAD camming, everybody. We'll see you next time.
See you next time.